Okay, good job. So I see that you're recording. I think you might need to, there you go. Great.
Okay.
Okay, so our first presenter is Sarah Panameno. Sarah is a major in psychology and is going to be presenting research on a survey of vaccine views of Hispanic parents. Sarah.
Okay, good morning, everyone. So as Dr. Rickert mentioned, my project is called Survey of Vaccine Views in Hispanic Parents, and Dr. Rickert is my faculty mentor. So to begin, there was a recent rise in global measles cases, about 30%, even in countries where the vaccine had already eradicated this disease. And some people considered that vaccine hesitancy, which is defined as a reluctance or refusal to vaccinate yourself or one's children, could have contributed to this rise. And also the fact that social media and the internet has allowed the spread of this information to occur, which could influence vaccine decisions. And considering the COVID-19 vaccine, people may be concerned, how is vaccine hesitancy going to affect the COVID vaccination rates? Also considering the disproportionate effect of COVID-19 infections and deaths among ethnic minorities and the recent rapid population growth of Hispanics in the US, it's important to consider how vaccine hesitancy could affect these communities in particular. Some possible causes, according to the World Health Organization, could be individual and social group influences and contextual influences, which I will describe more in detail coming up. So some examples of individual and social group influences are your trust in national government. Research has found that the less vaccinated you are in the past 5 years could be related to your national trust in national and local government, as well as how much you know about vaccines is also related to how willing you are to vaccinate yourself. And global studies have found that those who are encouraged by their social group to be vaccinated can affect vaccine views and acceptance. So education, research on education and vaccine hesitancy has found mixed results. In the US, higher education has predicted higher vaccine refusal, but lower education has also predicted both high and levels of vaccine refusal. In other countries, they have also found just as conflicting results, where higher education predicts one thing in some countries and lower education predicts other things in other countries. Socioeconomic status has also found mixed things in the US. Both low and high income participants have been found to be less vaccine hesitant, and conflicting results have also been found in Nigeria as well. So as for conspiracy theories on social media regarding vaccines, about half of tweets made in the US between 2009 and 2015 that mentioned both vaccines and autism included anti-vaccine beliefs. Previous research has found that belief in these conspiracy theories about vaccines does relate to vaccine willingness, as does being exposed to anti-vaccine content, as well as content refuting those theories affects vaccine willingness. And as for online sources, a recent study has found that those who received COVID-19 information from government websites gave more accurate answers to COVID-related questions than those who saw other sources for COVID-19 related stuff. And a study has found that Latina immigrant mothers are influenced by the internet, media, doctors, spouses, and their family to make vaccine decisions. Race and ethnicity. So the research on race and ethnicity and vaccine hesitancy has also found mixed results. Ethnic minority parents and adults were less vaccinated in general. It has been associated with high levels of vaccine concerns and negative attitudes towards healthcare providers. But other studies have found that white adults were less vaccinated with certain vaccines, and that white parents are more likely to refuse vaccines for their children than other ethnicities. So something else to consider is immigration generation. So for example, Latina mothers born in Mexico were more confident in vaccine hesitancy than Latina mothers born in the US. And those who identify less with US culture were also slightly more trusting in vaccines. And Latina mothers who identified more with US culture were more likely to allow their daughters to receive the HPV papillomavirus vaccine, which is a vaccine that is commonly refused by conservative parents due to religious beliefs. So for the current study, I was interested in looking at how the following
Ms. Mejita, stand by because I think I found it.
Oh, okay. How the following are related to vaccine hesitancy in Hispanic parents.
Find it.
So I was interested in looking at how trust in and exposure to the government, different types of media, trust in friends and family as health information sources, how all those are related to vaccine hesitancy, as well as socioeconomic status, education, and how much they identify with certain cultures. Specifically, I hypothesized that lower trust in the government, higher trust in social media, higher trust in friends and family as health information sources, lower socioeconomic status, lower education, identifying more with US culture, identifying less with Hispanic and Latino culture, and a higher number of years spent in an English-speaking country would all be associated with higher vaccine hesitancy scores. So for the study, there were 78 parents. Most of them were moms. All were Mexican heritage, but there was some variance in how they reported their own race. Most of them were first-generation immigrants, meaning that they were born in Mexico and then moved to the US. Most of them had Spanish as their primary language, and they were recruited from the Inland Empire area for a previous study that was looking for Catholic and Mexican heritage parents. And they provided consent after the first study to be contacted for further related studies. So all surveys were conducted over the phone and audio recorded as well. They took about 13 minutes on average. Data collection started in late February 2020, so only 2 participants participated before the COVID lockdown restrictions. They also were not asked COVID-related questions. And data collection ended in December 2020, shortly before the vaccine rollout. So the time between when they participated in this study and the first study varied from about 2 months to about 1.5 years. Since the surveys were conducted based on whatever language the parent preferred, most of them ended up being conducted in Spanish. So to measure socioeconomic status, we asked their annual income, renting or owning, whether they rented or owned a home, and how sure they were that they were able to secure food for the next month. All this was asked in the initial study, as well as their highest level of education and how strongly they culturally identified with one question for the US culture and another question for Hispanic and Latino culture, as well as how much time they spent in an English-speaking country, which we are assuming is the US, but could also include Canada or the UK or another English-speaking country. To measure vaccine hesitancy, we use the World Health Organization 10-item survey. So this measure includes different statements, and then we just ask the parents how much they agree or disagree with each statement. So an example statement is childhood vaccines are effective, agree or disagree. And although originally the scale was meant to be on a 5-point Likert scale from strongly disagree to strongly agree, we just decided to stick to disagree and agree for this study. And it still had good internal consistency. So to measure health news and health information sources, we asked open-endedly, where do you get your health news and health information? And we also asked how much they trusted the credibility of each of the sources that they listed on a scale of 1 to 10, 1 being that they do not trust it and 10 being that they trust it completely. And also we asked about specific sources. So we asked about Facebook / social media, television, friends and relatives, general online sources, the government and the religious community. And we also asked how much they trusted the information that they see on those sources to be true on the same scale of 1 to 10. We also asked from which outlets they sought out COVID-19 news and health information and how much they trusted the credibility of those sources on a scale of 1 to 10 as well. Also, if they would be willing to give a COVID-19 vaccine for their child. If they said no or I don't know, we asked them to elaborate on their reasoning. And finally, how certain they were that there was a link between autism and vaccines on a scale of 1 to 10, 1 being that they do not think there's a link, and 10 being that they are certain that there's a link between the two. So our results found that in general, our sample was not vaccine hesitant. The average was 1.9 out of 10. So 10 is vaccine hesitant and 0 or 1 is not vaccine hesitant. Education and socioeconomic status did not relate to vaccine hesitancy scores, and how much they identified with one culture, American or Hispanic, did not account for any changes in their vaccine hesitancy score. And the number of years they spent in an English-speaking country also was not significantly related to vaccine hesitancy scores. So when considering if they said yes or no to whether they saw health news and health information from different sources, there was no differences in vaccine hesitancy between the yes or no groups for social media, friends and relatives, general online sources, or the religious community. But for those who said, yes, I do see health news and health information from television, their vaccine hesitancy scores were lower than those who said no. And same thing for government. Those who said no, that they didn't see health news and health information from the government were more vaccine hesitant than those who said yes. And considering correlations between their trust levels in these different sources, it was found that those who trusted in television more were less vaccine hesitant, and that as the trust increased for government as well, their vaccine hesitancy score went down. And when we asked if they would vaccinate their child with the COVID-19 vaccine, there was a difference between those who said no and yes. So those who said no were more vaccine hesitant than those who said yes, they would. And for autism and vaccines, those who were more than 50% certain that there was a connection between the two were more vaccine hesitant than those who said that they were less than 50% certain of a connection. So considering all those results, we also found in our study that trust in government was related to vaccine hesitancy, but the relationship between television and vaccine hesitancy has not been found in previous studies. We also didn't find a connection between socioeconomic status and education. And something else that I would like to mention about these results is that the perception of the COVID-19 vaccine is unique, considering how the immediate necessity of the COVID-19 vaccine for the children of these parents to attend school and public gatherings. 91% of this sample scored very low on the scale, yet 62% of them said no or that they were unsure about giving their child a COVID-19 vaccine, which I think speaks to how people may be more unsure about this vaccine in particular. And also this refutes the idea that ethnic minorities or that immigrants are automatically vaccine hesitant or any of those kinds of perceptions. Some limitations of the study is a small sample size. So there weren't a lot of vaccine hesitant parents, so it might affect our ability to compare groups. And also, since there was such a varying amount of time between when they participated in the first study and this one, we could not account for any impact of COVID-19 on socioeconomic status. And also because participants participated across different times during the pandemic, like all the way in March versus December, we can't really account for how that would affect their answers and views on COVID. In the future, I think what could be researched is what aspects of Hispanic culture contributed to the relationship between government and television and vaccine hesitancy. For example, in the Hispanic community, is television seen as a more credible source? Or we could also investigate how people view television and government as a credible source. And also understanding the reasoning behind why people were unsure about this specific vaccine could aid public health officials in creating PSAs through television, for example, if people find that more credible, to specifically address their concerns, especially for this community that is disproportionately affected by COVID-19. So yeah, to wrap up, I would like to thank Dr. Rickert for her guidance, as well as Dr. Lesage, the honors program, for giving me the opportunity to conduct this study, and the participants for taking time out of their schedule to participate in this, and also my support system, my family, friends, and my boyfriend for being there and giving me support through all this. So yeah, thank you all for listening. And it is
Thank
now
you,
Q&A.
Sarah. Really well done. You can go ahead and stop the recording.